Welcome to Collegehood Advice. I'm your host, Katie Oliveira. Today on the show, we're talking about how to keep yourself and others healthy during COVID-19. I know that you are probably sick and tired of talking about COVID-19. It has disrupted everything in life, and I totally get it. But I cannot move forward without talking about some things that you can do to keep yourself and others healthy and safe as you move into the fall semester. So I've invited Dr. Jill Grimes on the show to talk about some practical, straightforward strategies that you can implement this fall and to clarify and dispel any misconceptions or myths that might be floating out there in the world about COVID-19 and your risks. So I know that you might be tired of it, but I think that this is a super important episode, not only for folks who are heading onto a college campus this fall, but for those of you who might be in a hybrid model or who might be doing college from home, or anyone who's working on a campus and is a little bit nervous about what the risks might be for them. We talk about what COVID-19 is and how it's different than the cold and flu. We talk about the particular risk factors for college students, some simple strategies and steps that students can take in addition to social distancing and mask wearing to help you stay healthy and safe this fall, as well as some other ways to maintain your health while you're on your college campus, where to go, and some resources to help you have not only a successful semester, but a healthy semester. Dr. Jill Grimes is a nationally recognized medical media expert, an award-winning author, a medical editor, and a board-certified family physician. She has extensive experience supporting the health of college students on different college campuses. Her passion is prevention, and she shares a ton of great information in this episode.
So,
yes, ma'am.
Dr. Grimes, thank you so much for joining me on Collegehood Advice. I am so happy you are here to talk about an incredibly important topic as students are navigating heading back to college this fall, how to keep yourself and others healthy during COVID-19. So thank you for joining me.
Thank you so much for having me.
I know that everyone listening has probably been hit over the head with COVID-19 and knows a lot about it and has heard a lot about it in the news and is at the center of most conversations with friends and family. But for good measure, so that we're all working from the same definitions, which is really important to me on this podcast, do you mind giving a brief description of the illness just so that we are all working with the same information?
Absolutely. So going back to basics, COVID-19. So the COVID is coronavirus. So the CO, the VI, coronavirus. And the 19 is because it was discovered or identified in 2019. So that's COVID-19. That's the disease. The actual virus is SARS-CoV-2. SARS stands for the severe acute respiratory syndrome virus. So this is in the family of the coronaviruses, which we've known about for a long time. They cause respiratory symptoms like the cold, but this one is much more than the cold. And at this point, this virus, which was originally identified in Wuhan, China, has now affected over 16 million people across the globe. We've had over 661,000 deaths worldwide. And here in the United States, we have over 4 million people infected and 150,000 deaths.
And so you started to hint at it, but one of the common things that I hear amongst young people especially is why do we need to approach COVID-19 differently than we would in other illnesses that we encounter, like the cold or the flu?
Exactly. And quite honestly, I will tell you, when this, back in February, when we were first hearing about it and there was only a trickling of cases in the United States, I was much more casual. I was like, our numbers from the flu, because I feel like people don't take flu seriously enough. And we see a lot of problems and deaths from the flu. And I felt like, wow, that's so much more serious. But there's two different reasons why this is different. Number one is on an individual basis. This virus will take two people that are healthy, and one person will have almost or no symptoms, and the other person can get incredibly sick to the point of being in the hospital and on a ventilator. And we right now, don't have enough knowledge. I mean, my goodness, it's only been a half a year, but we don't have enough knowledge to know what that little factor is in the person who gets really sick versus the person who doesn't get sick at all. So that's one major difference. The flu, we have antivirals that treat it. We have a flu shot that mitigates it and makes it less serious if you do get it, or even prevents it. We don't have a vaccine, and we don't have a single effective treatment that for sure is effective for everybody yet for COVID, although we are working on that. So that's very different. The other part about COVID that's completely different from the flu is flu's been around for a very long time, and we don't have hospitals ever getting overwhelmed suddenly where the ICUs fill up to the point where they're overflowing in every hospital in town because of the flu. We do see big surges in January usually, or February, but nothing like we have seen with COVID. And so it's a matter, we had to just completely rethink everything in medicine and think about stopping doing elective surgical cases so that we had open beds. And it's just a whole different animal.
And one of the other misconceptions that we hear is that a lot of students believe because they are young. Now, not everyone listening to the show, and not every college student, of course, is young. Our audience is very diverse and very broad in their age range, but many of them are in the traditional age range. And so what are some of the risk factors that college students in particular need to keep in mind?
Well, in terms of, you're right. For the traditional college student that is young and otherwise healthy, their bigger risk factors are that they're around so many other people. It's about the crowds and the infectivity of this, and especially our colleges pride themselves that they have students from all across the globe and every single state in the United States. And we're going to have all these people pouring in from all these different places with very different attitudes about COVID-19, whether they wear masks or not, whether they've lost family members to it, and frankly, just straight up exposure. We're going to have people coming in from all over, and colleges are really, wow, they're doing so much. I would not want to be a college administrator right now because this is so difficult, but they really are. They're trying to test everybody before they move into the dorms, if they're allowing people in dorms. They've cut down the dorm occupancy. Almost every college that I'm aware of, so not 100%, they've made dorms single occupancy, but the main risk factor for college students is density. All these people coming in, different risk factors, being all together, sharing bathrooms, etc.
And of course, also that there are diverse numbers of people they might be encountering. And also if you're
Exactly.
different age ranges, not everyone who's on a college campus is in a low risk age range.
Right. And we have so many childhood cancer survivors, people with juvenile diabetes. I mean, we certainly have a ton of people who have traditional risk factors where they have difficulty with their autoimmune defenses because, say, they had cancer, childhood cancer, and they were undergoing chemo or whatever. They've had a bone marrow transplant. We have, and then we have our non-traditional students who may be older and have high blood pressure, adult onset diabetes, other risk factors like that, or kidney disease, etc.
So what can students do to take care of themselves and others, keep others and themselves safe, whether they're on campus or off campus, depending on what their school's approach is this fall?
We all know the big three, right? Those have been beaten into the ground. I would like to say one word about masks, though, if I may. So,
sure.
Masks, super important. I know you know how to wear them. That has to cover your nose and your mouth. This is my Wonder Woman mask, which I love. But what I want to say is you need a bunch because you have to wash them every day. We joke about it, but we say, think about it like underwear. You wear them one day, you wash them, you put them in the laundry. So you need enough to wear a clean one every day. The other thing is, if you can, the reason they have these little pockets in them is to add in a filter. This is just a coffee filter. If you have the 2 layers of cloth plus the coffee filter, much more effective than just a flimsy bandana or something. So masks for sure, social distancing, and sanitizer. We all know that. But let's talk about the other things that maybe people don't think about. Number 1, use your own restroom before you leave your dorm or apartment. a lot of people don't care for public bathrooms anyway. I've actually spent 10 years telling people stop worrying about bathrooms. You don't get STDs there because you don't. However, now because bathrooms have generally poor ventilation, they don't have windows in them, it is kind of a higher risk place for, not kind of, it is a higher risk place for catching COVID. So try and use your restroom before you go. Second thing, glasses. If you wear contacts, consider updating your glasses prescription and get some cute glasses for the fall, because glasses basically function like goggles, right? They protect your eyes, and we know that eyes, mucous membranes in your eyes, nose, and mouth, if you get respiratory droplets there, that is how you can catch this. So it's an extra layer of defense. In terms of activities, always pick outdoors over indoors. So you want more ventilation. Anything outdoors is going to be so much better, especially if it's spaced out. Now, a crowded outdoor concert, you know, nowadays I don't think anyone's going to have, well, they're not going to sponsor anyway, crowded outdoor concerts, but, you know, really try and respect that distance, be outside, enjoy it. That's fine. That's a much lower risk activity. When you're thinking about things like golf is fine, tennis is fine. Frisbee golf is a really big thing in Austin. Mm-hmm. We love our Frisbee golf, and that is a great activity and safe to do with friends right now. So pick those kinds of things. Next thing, so I try to only offer evidence-based advice. I want to talk about zinc lozenges. So there's been debate, scientific debate for years about whether or not zinc shortens the course of a cold. Does it prevent the cold? Does it shorten the course? And actually there are studies that are conflicting that show both ways. But we do know that the zinc lozenges, when you're sucking on them, and this is, there's a name brand, which I have no affiliation with, Colby's is one of them. Can't think of any others off the top of my head, but at any rate, it's just, you know, the little hard candy-like thing that you put in your mouth. When you have that in your mouth, it decreases respiratory viruses in general from replicating in your mouth and setting up shop and causing infection. And so we think that may be the case with COVID as well, since it's another respiratory viral infection. So one thing you might consider doing is if you're going to be, say, on a bus, shuttle bus going to class, or any kind of super crowded situation, which you think about a lot with transportation, just pop a zinc lozenge under your mask as well and suck on that. So that's something to consider. Another thing is, another big thing in Austin, Texas is seasonal allergies. And if you are coughing, sneezing, dripping down the back of our throat, think about what that's doing to the inside of your nose and mouth, right? It makes it really raw. And that is that's our first line of defense against all respiratory viruses, whether it's flu or COVID or cold virus. So optimize your health, meaning be proactive with your seasonal allergies. Talk to your doctor. Think about using an over-the-counter steroid nasal spray, not because it doesn't prevent COVID, but what I'm saying is that it keeps your primary line of defense intact. So that's something you can do to help. Same thing with asthma. Make sure that if you have asthma, make sure your inhalers, that you're using your inhalers, that you've visited with your doctor recently, that you've got an asthma action plan, and you're optimizing that respiratory health, which also means no smoking, no vaping, no smoking, no cigarettes, no pot, nothing. The only thing you want to inhale is oxygen. And one last tip is high touch surfaces. Our phones go everywhere with us. A lot of people use them in the bathroom. A lot of people go to the bathroom to check their social media or whatever. We have to clean these better. And cleaning means wiping clean, but sterilizing means wiping clean with, you know, a sterilizing wipe, or using a UV light box. Have you seen those? It looks like a little, here, I've got one right here. Actually, sorry, leaning off camera, but it's just a little box, and you pop your phone in there. A lot of them do charging at the same time, but that will sterilize it, because these high touch surfaces, you know, we know we're pretty good now when we have a mask on that we don't touch our face, but you take the mask off, you're at home, you're doing this, and, you know, we just can't help it. We sneeze, touch our face. And so let's get those clean.
So one of the things that I'm noticing is that it's really, you need to do all of the things that you mentioned, because I see in my own experience, in my own life, observing people, especially young people, that if they're they feel like if they're socially distanced and they're outside, then they ditch the mask, or if they're in public, they wear the mask, but not in private circles with their friends and their family. And so do you mind speaking a little bit about the importance of these strategies being all part of one effort, as opposed to how you make decisions to sort of break them apart?
Yes, I think that's a good point. And particularly for students returning to college campuses, I actually think for freshmen, in some ways, it's going to be easier because it's all new.
Mm-hmm.
But if you are a returning student and you get back and you're sitting in the lounge with, say you're an animation major, like my daughter, and they're all sitting around, they're it's going to be hard not to just relax and revert back to everything that was familiar for you before. And so, yes, I do think it's really, there's going to be so much signage everywhere that will help us remember in these settings. But you're right, this has to be just sort of an overall choice. And the reality is, do you need to wear your mask all the time with your suite mates? No, that's not going to happen. And, you're going to end up with your little COVID cohorts where you're, people talk about quarantining together with a couple families. It's the same idea, because there are some people that you're just going to be around all the time, and it's not going to happen. And that's okay. But if you've got someone, say you've got 3 suite mates, and one is going out partying every night, everywhere, and not following precautions, you might want to wear a mask around them. These are going to be difficult decisions. And I think this semester, more than ever, I hope RAs will really be focusing in the dorms, particularly with our freshmen, talking about the importance of immediate and open communication, because this is going to be a real constant issue this year when you've got some people who are cautious and some are not, and figuring out how to balance that and work it all out.
Yeah, absolutely. Well, let's say we are exposed. What are your recommendations if someone feels like they've been exposed, or they're showing symptoms of exposure? What should students do?
Okay, so this is going to depend a little bit on your campus, but virtually every campus will have testing on campus. And the idea is, so one, if you have symptoms, you definitely should call. Everything is going to be calling, or at least going online first, because the health centers want to bring you in. If you have symptoms, you're going to be treated differently than someone who's got a sprained ankle and is coming in. So first thing is you contact your student health center or urgent care if you're going off campus, or primary care physician, et cetera. You contact them first and find out how and when they want you to come in. Once you actually have symptoms, most people will go ahead and test you then. If you've had a concern of exposure but no symptoms, a lot of times we're saying to wait for at least 5 days or 6 to 8 days before you get tested, because it won't show up if you're tested early when you have no symptoms. We're working on all that, and it really depends on what test your particular health center is using. But the concept is, if you have symptoms, and tests are not all rapid. Most universities are trying to get rapid tests, but many places you still have to wait several days. And while you're waiting for those test results, you should be quarantining. You should be staying in your apartment and not going out. And really, you should be isolating if you have symptoms. So isolating means